my pleasure to welcome everyone to this press conference. This press conference is for WASPEN Clinical Nutritional Conference, which is taking place, which is in collaboration with National Hospital Abuja, which will be taking place in Abuja.
So again, it's my honor and privilege to welcome each and every one of you to this press conference as we prepare for the anticipated West African Society of Parenteral and Enteral Nutrition conference that is coming up in June, which you all have heard CEO Africa mention briefly. This event really represents a significant step forward in a collective effort to address hospital and community malnutrition. I know a lot of us hear a lot about the community malnutrition. What is going to be new, maybe to most of us this morning, is the hospital malnutrition, which is actually a silent but devastating crisis, often referred, when you look at the literature and studies that have been done in the US, as skeleton in the hospital closet. What am I saying? There's a need for us to address hospital malnutrition. It is an urgent situation. Malnutrition remains a major yet overlooked challenge, both in the acute care hospital settings, in the community setting, both in our young, adult, elderly patients in the hospital, especially those with chronic illnesses or those who have undergone surgical procedures, of those in the critical care unit. I guess one question we ask is that why is it that we say so much about malnutrition? Malnutrition has a lot of not only economic impact, but clinical impact. Studies have shown that patients who are malnourished stay in the hospital longer, thereby driving up the hospital cost, do not do well after surgical procedures. Their wound will not heal. You will see some their wound will be hissed. So there are a lot of clinical and economic consequences with malnutrition. That is why it is extremely important for one to really pay attention to what's happening in the hospital. So what is WASPEN's vision when it comes to, hospital malnutrition? WASPEN's vision is to create a center of excellence. And we actually started that last year when we held our first conference in a tertiary care hospital, which is LUT. And through that conference, we were able to come up with some actionable goals that is being implemented in that institution. For example, one of them is we recognize that, yes, hospital malnutrition exists, but there's no data to support what we're saying. So we're looking at coming up with studies. Hopefully we will be able to pilot it in LUT, looking at the prevalence of hospital malnutrition, and hopefully we'll be able to do it, having a multi-center study to study it and really see what the incidence and the prevalence of hospital malnutrition is. And when you look at the theme of our conference, we are trying to really show that there's a gap between community malnutrition and hospital malnutrition. And that's why we call the theme of our conference Bridging the Gap. Integrating hospital and community malnutrition care in developing countries. And again, this came out of what we learned when we had the conference at LUT last year. We are privileged to have outstanding speakers and keynote speakers because we believe that in order to address this hospital malnutrition or malnutrition, we have to use the multidisciplinary team approach. So what is the message that I'm trying to send this morning? What the message I'm trying to send across is that it is time for us to recognize that hospital malnutrition exists, and this message is to the president so that we can come up with priorities. We can come up with initiatives such as identifying patients who are malnourished when they get admitted to the hospital. And the way we can do this is to have screening tools, to have multidisciplinary committees made up of physicians, nurses, dietitians, pharmacists that work together to ensure that this is done. As soon as a patient is admitted to the hospital, we need to screen those patients' nutritional status so that we can early identify what their status is and start intervention early. We want this message to go to the president for us to really have such initiatives in place. We want the Federal Ministry of Health and State Ministry of Health to really have their efforts to focus on malnutrition and come up with several different kind of initiatives to make sure that this is done. We want this message also to go to hospitals and healthcare institutions, like I mentioned earlier, to implement the mandatory screening tools. We want the National Agency of Food and Drug Administration and Control, NAFDAC, to support safe and effective regulations that pertains to nutrition support. We want the National Primary Healthcare Development Agency to expand nutritional programs in these particular areas. Then, of course, another thing that is also very important for the pharmaceutical companies and nutrition companies to also invest in research, to invest in coming up with nutritional formulas, both parenteral formulas and enteral, where we can manufacture them in Nigeria. And why is this important? This is important because this can make the products easily available and also accessible to our patients and most likely affordable. We want non-governmental organizations and public-private partners to collaborate when it comes to funding and advocacy of nutrition support. So these are the messages I want to send across today. It starts with the president, then, and all these other agencies that I've mentioned. We need to make hospital malnutrition a priority in our country. I also want to applaud all the good things that has been done with community malnutrition, but it's time that we also recognize that this same thing is happening in the hospitals, and we need to join forces together to try to address this. So in conclusion, what I'd like to say is we invite all healthcare professionals, researchers, policymakers, industry partners to participate in this landmark conference. We will be discussing a lot of key strategies that will be able to address some of these gaps that I've mentioned. And collectively, we all can put our hands together and try to address this malnutrition, which is termed, is there in hospitals, and it's not only affecting adults, it's affecting children, pediatrics, neonates, and it's really time for us collectively to do something and work together to address them. So that is my message this morning. Again, I want to thank you all for coming this morning, and hopefully we'll be able, if you all have any questions, I'll be able to address them.
The conference is supposed to start on the 17th of June, but on the 16th, we're going to have a pre-conference workshop, and the workshop is we're going to have hands-on training on how to use nutritional kits in the hospital. And then on the 17th, there will be a health walk. The health walk, we're hoping that our mama, the First Lady of the Federal Republic of Nigeria, that's Senator Oluremi Tinubu, will lead the work together with other dignitaries and stakeholders that are available. The health work basically is for us to create awareness on the fight against malnutrition in our society and in Africa and West Africa as a whole. On the 18th of June, we'll be having the opening ceremony, of which our keynote speakers, address speakers, will do justice to the theme of the conference. And on the 19th, the conference will end with panel discussions. And at the end of the conference, we hope to achieve a purposeful direction towards the fight against malnutrition. Thank you.
Good morning, everyone. Good morning, Madam President Pound.
Good morning.
My name is Omolere Omoeton, writing for sunrisebulletin.com. My question has to do with, I've seen the flyer promoting this event, but somehow I noticed that nobody from the agricultural sector is listed as one of the guest speakers. And I think that a program like this that has to do with nutrition should have a major stakeholder, maybe the Minister of Agriculture or some other persons that can also talk about food production, because since we are talking about nutrition, food is the basis for that. Thank you. That's my observation and why such a person is not listed among the guest speakers. Thank you.
My name is Akim Adegbero. I report for Blueprint newspaper. So in an addendum to that question, I also feel that malnutrition, especially in Nigeria, is a very important topic. Knowing fully well right now, we have several food insecurity in the country. And that is basically because of where we are coming from. The farmers, elders clashes, and so many other insecurity that has affected farming, especially in the rural area. I also feel that as part of the stakeholders for this conference, we should also look at bringing on board the security as stakeholders to also speak on the challenges of securing our farms so that we can have food security that will also dovetail into having nutritional balances in the country. So just an addendum, why is the security not also a part of stakeholders invited for this conference? Thank you.
I don't know if what WASPEN is trying to address is hospital malnutrition. What the agriculture and all these points that you guys have brought up, a lot of this are malnutrition that occurs in the community. Your patients, they're not really patients. They are okay, but they are malnourished. WASPEN is addressing malnutrition associated with illnesses, patients who are in the hospital. Maybe a patient who has some GI problems and get admitted to the hospital for like a surgical procedure. And that patient becomes malnourished while they're in the hospital. Or a patient that has problem with the stomach, I'm just going to use some layman terminology, and cannot eat the way me and you eat. So they need what you call artificial feeding. They need food, not the regular food like you all are talking about, but the artificial nutrition that has to be fed either through the veins, and in some cases, you have patients, elderly patients, who there's nothing wrong with their stomach, but they're just not able to eat enough on their own, and you have to force feed them, meaning you have to put a feeding tube to their nose, to the stomach, and you feed them. So it's a different type of nutrition. And that's why I was saying that there's little awareness about this type of nutrition support. That's why patients who are admitted in the hospital that are ill, because we still we lack awareness of this. Number one, they do not know what their nutritional status is. And then when they finally see that that patient is malnourished, sometimes it becomes too late. Patients, the incidence of malnutrition in hospitals is high. Mortality because of this is high. So the type of malnutrition that WASPEN is addressing is malnutrition associated with your sick patients who are in the hospital. So when you look at that, WASPEN is not saying that we're not sensitive to what's going on with the other type of malnutrition in the community setting. No, we are definitely sensitive, because if you have a patient who is well nourished in the community, most likely if they are ill and they get admitted to the hospital, their nutritional status will not be that poor, will not be that bad. So there has to be a link, there has to be a collaboration between the two. And that's why, if you look at the theme of our conference, it's talking about bridging the gap. But our focus is hospital malnutrition, the specialized nutrition support, or the artificial nutrition support. How actually do you address those patients that get admitted in the hospital? I don't know if you all have had relatives that get admitted to the hospital, maybe for a surgical procedure, and that patient's wound will not heal. I live here in the United States, and I have friends and family members in Nigeria. How many times have I received calls to say, listen, my relative is in the hospital, the wound is not healing, they're not able to get that patient off the ventilator. Then when I ask, okay, what is going on nutritionally? They say, well, the patient, that person is not able to eat and all that. So that patient goes without nutrition. So that is the point I would like to make. So if you look at understand what I'm saying, when you look at a conference that is like 2 or 3 days, you choose people that have that background, that knowledge, to be able to send this message loud and clear. I hope I've answered your question.
Addressing malnutrition is a multifaceted approach, and a lot of organizations are doing something in their capacity to be able to address malnutrition. On WASPEN, we are having this press conference first to educate people about this niche, this clinical nutrition niche that Dr. Pounce is talking about, that people have little knowledge about, to be able to create the awareness. First, be able to differentiate the regular non-specialized nutrition from the specialized nutrition. And WASPEN is trying to address this part that Dr. Pons had just explained, that requires specialized nutrition care for these patients. And that is the reason why we're having this press conference, so that we can be able to utilize the media to be able to create awareness and at least educate people, so that when they hear about nutrition, they all understand that it's also an issue in the hospital. So, and I can understand why they're asking about the agriculture and the security, but just to make that clear that we carved out the niche and that we are working and trying to address, which is like you rightly say, the hospital malnutrition that requires clinical nutrition care. And that's what we're trying to do with this press conference. So I just wanted to add that and make that clear to what Dr. Pounce has previously said.
Like he mentioned, that is the goal of this press conference, to really educate people. Like he said, increase awareness. And what is happening in Nigeria today happened in US a couple of years ago, before they realized that hospital malnutrition existed. And that's why they named it. One of the doctors, Dr. Butterworth, he wrote a paper and he named it that there's a skeleton in the hospital closet, meaning there's a skeleton in the hospital that people are not aware of, and that's what they named it, hospital malnutrition. So it's the same thing happening here in Nigeria and in West Africa, that this malnutrition exists in hospitals and that we need to identify. We need to identify patients' nutritional status when they get admitted to the hospital. And the way you can identify is through nutrition screening, utilizing the multidisciplinary team approach, dietitians, nurses, physicians, pharmacists. And also, once you identify and you realize that the patient is sick and their gastrointestinal tract is not working, meaning their stomach, then we have to have means to feed them. That's why you see a lot of patients in the hospital just lying there, malnourished. They will not do well. I don't care what medications, what surgical, because you have not addressed their nutrition. So it is a problem. And we need to, and that's what WASPEN is all about.
Yeah, my name is Nino Dufaya from Lugo, Nigeria. I would just like to know, yes, for how long has this problem been existing in Nigeria? When do you begin to notice it?
Okay. Another good question. First of all, I've been in the US for close to 20 plus years. I come to Nigeria 2 or 3 times a year. I do medical missions. It was during all the time I was coming to Nigeria doing medical mission. I was also involved a lot with being a pharmacist. I'm a clinical pharmacist, by the way. I was involved in various clinical pharmacy activities. It was during that time that's when I recognized that there is a gap here in patients who are in the hospital, that malnutrition exists and that nobody's paying attention to it. So I would say that that's probably been a couple of years back, and that's what led me to now start my own NGO, WASPEN, because I also belong to ASPEN, which is an organization here in US. So being actively involved in that organization, I was able to say, okay, I need to look at what can be done in West Africa. So obviously I utilize Nigeria first as the country that I'm going to try to start it. So that's why I could have named my NGO NASPEN and just focus in Nigeria, but I named it WASPEN. So eventually, I'm hoping to, expand what I'm doing to other West African countries. So in answer to your question, it's been a while. First of all, if I'm able to ask a question, how many of you who are here on this call today have heard about what I'm saying? I've heard about hospital malnutrition. Like a lot of you have heard about what's going on in the community, the food insecurity, and so on and so forth. Yes. But how many of you have heard about what's happening in the hospital?
As Dr. Pound said, I am a pharmacist. I do a bit of work within the self-care space. And I'll tell a little bit of a story about my own personal experience with this hospital malnutrition. It's there. It's been there. It's almost like the elephant in the room or in the hospital. And sometimes it doesn't hit you until you experience it. My mom was sick and in hospital, and she was not taking anything orally for almost over 10 days. I think I called Dr. Pounds. It suddenly struck me one day. We're talking about malnutrition, nutrition. I'm in the middle of this, and it didn't strike me until way down. And I had to call Dr. Pounds, and she engaged the hospital. I am a healthcare professional. I'm a pharmacist. And even within that hospital setting, it wasn't picked until I said, yeah, she's getting all the IV support. She's getting antibiotics, but there's no nutrition support happening here. We had to set up an NG tube, and Dr. Pounds was communicating with them remotely to do that. So it's there.
Yeah.
It is there. Trust me, it is there. And I was listening to all the comments about the security and agri, and Dr. Pounds addressed, yes, that's another level of malnutrition that exists in the community. But in the hospital setting, you go in, you're okay, and then because you are admitted, you have some status that does not allow you have the nutrition that you need, you move from an ideal nutritional status to be malnourished within a hospital or clinical setting. So it's very real. And I think this conference is very timely, and I expect that the media will pick on it. I love the questions, the interrogation, and help to increase awareness about this issue. There's so many issues. And then when we talk about self-care, it's part of it, because self-care is not only about self. If you are a healthcare provider or you're providing healthcare support, you're a caregiver, you also have to be aware that this is something that could happen to somebody you're taking care of. So it's very, very important that we are all primed and aware about this.
On behalf of my CEO, Chief Emmanuel Umenwa, and the entire management team, we want to say that we are pleased to be one of the sponsors of this great event, and we pray that whatever this event wants to achieve, whatever it aims to achieve, it will achieve it, and our healthcare will be a better one.
Quite very supportive of what you are doing, and I do hope that I may not be very much, in line with getting the full signal because I'm on the road. I want to catch up a flight, but I do wish you a very, very fruitful competition and discussion. Eventually, I get to the airport. I'll still tune in. Right now, I'm on the highway. Thank you very much. Thank you, the audience. I wish you a fruitful deliberation.
My name is Godfrey from Classic FM Lagos. So, Madam Teresa Pounds, I would like to ask you, why the choice of National Hospital, Abuja? Why not partner with general hospitals where we have so many patients overwhelming the doctors on a daily basis? So why the choice of National Hospital?
First of all, when I started this educational programs, it took me about 2 years to realize exactly which direction I wanted to go. So the first hospital that I chose was Lute, because I felt like in a teaching hospital such as that, and they are also very well known. They've done a lot of initiatives that are points of excellent programs, and their reputation is very strong. So I chose that. So, and then I'm changing locations. So I did Lagos. So the next place was Abuja. And I felt that National Hospital was also, being a teaching hospital, well-known hospital, I needed to do it in that hospital. But eventually, and I'll be honest with you, eventually I'm going to be going to the general hospital. I just started. My NGO is only like about 5 years old. So I still have a whole lot of work to do. I'm still talking to different institutions, different people. So I eventually will get to the general hospital. But I felt like starting with these hospitals, get the message out there, and then continue to get ambassadors. So in fact, the other thing I'm also thinking of is, instead of once a year clinical conference, that I may even do more than once a year. I may even do, like, if I have like a hospital, that I can do like a workshop, specifically for that hospital. I probably can do that. So I think the answer to your question is, I wanted to start at least with the teaching hospitals, the well-known hospitals, then eventually start branching to the other ones. But I'm open to any kind of suggestions you'll have in terms of that. Because you're right. That's But then we also have the same issues in all these other hospitals, the teaching hospitals, you know. So so that was my rationale for doing what I did.
My name is Idowu John. I'm from a Mega Icon magazine. Earlier, I was bewildered when you started discussing on the hospital malnutrition, because I want to believe that health facility should be the best or appropriate place to get best attention or care. However, the first question is this. I want to know, what are the main causes of malnutrition in hospital? Is it due to budget constraints, poor food quality, or lack of awareness? That's my first question.
Okay.
And my second question, I want to know, can you provide a statistics on the prevalence of malnutrition among hospital patients in Nigeria, since you are taking Nigeria as a case study?
Very good. I mean, the questions you all are asking really does show that you guys are listening to what I'm saying. And that really, you know, I'm really pleased about that. And I want to appreciate you for that. So first of all, what are the causes of hospital malnutrition? You asked a very good question. Why does it exist? Why is it that when patients get admitted to the hospital and maybe their nutritional status was not the best coming in from home, right? And they get admitted to the hospital, maybe for a surgical procedure. Typically, what you do for those patients, you don't give them anything by mouth. You don't have them to eat. Because you're doing a lot of tests, different kind of tests. And I'm trying to use some layman's terminology here. You give them plain IV fluids. Then you take them to surgery. The surgical procedure itself can affect, it's an insult on the human body, all right? So you take them to surgery. But keep in mind now, that patient has been without food for like maybe a couple of days. So what do you think is happening to that patient nutritional status? It continues to decline. Then you take them to surgery. They have that surgical procedure. Then, because right after that surgery, if it involves the stomach, they're not going to be able to, they're going to keep them MPO, meaning nothing by mouth, for a few days. So what happens is that the patient's nutritional status continue to decline. Now, you asked a question. Why is it happening in Nigeria hospitals? And I would say lack of awareness is the biggest reason. That's number one. Because when you know you have a situation and you believe there's a situation, you're going to find ways to be able to take care of it. Lack of awareness. And that's why I asked that question I asked earlier. How many of you that are here listening to me know that malnutrition exists in the hospital? What you guys hear a lot about is what's happening in the community, the food insecurity, the other. You hear all that. But do you all hear about patients who are in the hospital, who are sick, who have chronic illness, who have had surgical procedures, who are malnourished? Have you? No. So I think the answer to that question, the first answer is lack of awareness. The stakeholders, the powers to be. And that's why I said my message is to the president. So my big thing I'm doing too is advocacy. And that's also one of the reasons why I'm choosing LUT. I'm choosing National Hospital. Hospitals where I know they have connection, that the people that are in those positions to make decisions are probably affiliated with them. So lack of awareness I think, is the number one. Then, of course, because of lack of awareness, you also have lack of human resources. Dietitians are very vital and critical when it comes to clinical nutrition of patients in the hospital. When you look at the number of the human resources, it's probably not enough. Probably same with nurses. Then the third thing is the infrastructure. You need that team approach to take care of patients. We all know that in Nigeria, we're still a little bit struggling with that. And what I mean is, we're still struggling with all the key disciplines working together. It's improving, but it's not where it needs to be. People recognizing that the medical doctor is the lead, but then all the other disciplines have to be carried along, meaning the dietitian, the pharmacist, the nurses, working together for the benefit of the patient. That's what you call patient-centered care. That's another one. You asked me about what is the prevalence of malnutrition in Nigeria. That's why we don't have data. We don't have data because we don't know that something like that exists. So that's one of the things that WASPEN is working on. And I'm pleased to announce, based on the conference that I had last year with LUT, they formed their nutrition committee, a multidisciplinary nutrition committee. It's led by a physician, it has pharmacists, it has nurses, it has dietitians, and we are now working on a proposal, a research proposal that is going to look at prevalence of malnutrition in the hospital, and we're hoping to make it a multi-center study, meaning looking at the different geographical zones. So that was also another reason why, when that question that was asked, why did I choose teaching hospitals? Why not? So all these things are all strategic. So I would say, if you ask me, what is the main reason? The main reason is lack of awareness that this exists.
Thank you so very much, Ma. Once again, my name is Omolere, sunrisebulletin.com. I've learned a lot from your remarks so far, and I must commend what your organization is doing, because from personal experiences, I've seen situations where elderly people are at the clinic and people say they are not eating anything, and they tend to give them pap, that because it is light, not just because it is nutritional, but because it is light. So they try to force them to eat such things, which of course make their treatment a bit more difficult.
That's correct.
Earlier, you spoke about lack of awareness. Now, lack of awareness on the part of, is it the patients or the professionals that should know and do not know? That's my first question. Ma?
I think it's everybody.
Okay, but you don't want to put the blame on the part of the professionals who should know and do not know.
No, go ahead. I didn't mean it, but please go finish.
Secondly, Ma, what you have said, the advancement in clinical nutrition, it's around the world is advancing, is going very fast, and we have not even started in Nigeria. What is WASPEN going to do to ensure that at least hospitals in the country begin to adopt these advancements in determining the nutritional status of patients before they even commence treatment? Thank you.
Good points. Good questions. Now, you said the lack of awareness. Who are the people who need to be aware of malnutrition? That's what I said to everybody. And you know why I said everybody? First of all, these key stakeholders, the Ministry of Health, all these people that are called, the president, they need to be aware that hospital malnutrition exists, and then it trickles down. So the leaders, the leadership, the leaders, the key stakeholders, the hospital administrators, the healthcare professionals. We need to look at education, nutrition education in medical schools, in pharmacy schools, in nursing schools, in the school of dietetics. In fact, I would say in Nigeria, maybe the dietitians are probably the one that do a lot more education. Yeah, and I'm a pharmacist, and I'm on faculty at about 2 universities in Nigeria. One of them teaches nutrition support as well as part of their curriculum. The others don't. So nutrition has to be in the curriculum for medical schools, for nursing schools, for pharmacy schools, and also the dietitian. Then why I said everybody, if I am, as a family member, I need to be educated about the types of nutrition support, for my family. So if I'm educated and I'm aware, I'm going to make sure that my family member is taken care of. That's why I said everybody, even the lay people. All right. Then the other question was, what is WASPEN doing about this? Or what am I, a Nigerian? I'm a Nigerian. I've been in this country, in US for years. And I saw that this was happening. I could have closed my eyes and just say, hey, I'm not going to do anything about it. No, but I decided that I will form an NGO. A lot of what I'm doing right now, I'm doing out of my own pocket. I formed the NGO and I said, I know the biggest issue is lack of awareness. I'm going to start educating people. So I started educating through the clinical conferences that I give. So I started the yearly conference. And that's what I said, that it took me about 2 years to really know exactly what direction I was going to go. The first 2 conferences I did, I did not do it in the institution. But by last year, I realized that this situation is happening in hospital. Since it's happening in hospital, I should be targeting hospitals. And that's why I did my first conference in Lut. And what I asked the hospitals is that if I do the conference there, then I want to make you a center of excellence in nutrition. Making you a center of excellence in nutrition means you have to have a multidisciplinary nutrition support team, a nutrition committee, and also have a team. You have to have mandatory screening. When your patients get admitted to the hospital, you need to screen their nutritional status. And if their nutritional status is poor, you need to start early nutrition intervention. Then the third thing I did is, I said, well, yes, we do all this, but these people cannot afford the product. First of all, the product is not readily available and it's not affordable. So I'm partnering with one of the major pharmaceutical companies in Nigeria. Fixing, the guy listened to me. So hopefully something good will come out of them, whereby some of the products will be made in Nigeria. And, to be able to address. So those are the things that I've done and continue to do. Then last year, I had what you call the Malnutrition Awareness Week, whereby I had press conferences. I have ambassadors in different hospitals. WASPEN is a multidisciplinary, it's an organization whereby nurses are members, pharmacists are members, dietitians are members. So through the membership of these people, they are the ambassadors that are going to different places to continue to pass that message along. So these are some of the things that I've done and will continue to do.
This is Tolulokwe Deborah reporting from CEO Africa. I have a question, ma.
Yes, please.
Yes, ma. Given the current situation, do you believe that malnutrition, particularly in hospital settings, is a condition we can effectively tackle or potentially eliminate within a certain time frame?
I think it's difficult to say within the time frame if we don't have strong commitment yet from the people that really make the decisions. I think we have to start from the top, and the top, and I've had all the agencies that I feel are involved outlined, and I'll be glad to share some of this information with any of you. I think we need to start first with the president. The president, he's the and luckily he's doing some things with the community malnutrition, and I'm hopeful that as we continue to share this message and increase awareness, that the powers to be will hear and will be able to, and will realize that this is is definitely a very, very important issue that we need to address. If we look at patients who have probably lost their lives, in fact, there was a very sad case that happened in Lagos, a young boy that had surgery. I think that's a good example of what I'm talking about. He had surgery, and it was it was mentioned that when he had surgery, that his intestine was stolen. What they did not understand is that his intestine was not stolen. He had surgery, he had complication of surgery, and they had to cut some of his intestine due to that complication. So he ended up with what they call a short gut syndrome, meaning the length of his intestine is not the normal length, meaning the only way this boy could stay alive, could have nutrition, is IV, intravenous, meaning whatever he eats, like me and you eat, is going to go right through him. It's not going to be absorbed. Unfortunately, they could not afford the product because these parenteral specialized nutrition products are expensive. That's another thing that WASPEN, that's why WASPEN is partnering and collaborating to see how we can make those products in Nigeria, because if they make them in Nigeria, it's going to be more affordable. To make a long story short, this boy died. How many cases of such a thing happens? I know of cases, my friends that are in Nigeria, some of them that have called me. By the time they call me, it's too late. So I think it's difficult to say how long this is going to take. But I think the first step is for the powers to be to realize that this is a very, very urgent situation that we need to take care of. And that's why WASPEN is committed to doing everything we can to continue to send this message, send this message across. But I'm still hopeful.
My name is Pharmacist Judith.
Yes.
So, ma'am, considering the importance of this topic and the need to urgently begin to create awareness and generate data to support the claim,
yes.
I want to know how soon you plan to start a research on the prevalence of malnutrition in Nigerian hospitals. I'm asking this because I'm an epidemiologist and a biostatistician as well as being a pharmacist. So currently I'm with LASU, Lagos State University. I'm a student of I'm a PhD student with Lagos State University. So personally, I am interested in this topic. And I know that my school will also be interested in this topic as well. So I want to find out, how soon do you plan to start this research so that we can have data to support the claim? Thank you, ma'am.
Thank you. Excellent. That's a very good question. LUT is partnering with WASPEN. We just did our first proposal for the research, and talked about, and then looked at the methodology, and we had our very first meeting about 2 weeks ago. It was a robust meeting. We've kind of agreed that it's going to be a multi-center study, and we're going to look at the different geographical zones. We may end up with like about 6 or 7 hospitals, and we want to try it in the tertiary care hospitals. in answer to your question, we have a very, very aggressive timeline. Our conference is in June. So we're now in like in March. I would say at least by March, April, we would have gone through our proposal, then taken it to the nutrition committee at LUT before it goes to the ethics committee. We also recognize that we're going to need some funding, because once the proposal is approved and you start the research, you have to have some funding in terms of the data collection, because it's going to be a prospective study. And at the same time, we will also study the nutrition screening tool, because you remember I mentioned that institutions need to make nutrition screening mandatory. All right. So we're going to be studying that. So I would say at least before June, we would have gone through the proposal approval, and then maybe be ready to start the data collection. But please, I would like to keep in touch with you. All right. And then we can talk offline. I love your background. Your background is the type of background we're looking for, and we can see how we can talk more and collaborate. At least keep you posted.
We have Omolola,
yes,
from Radio Nigeria Network Station Ibadan. Does malnutrition only happens to those that undergo surgery, or it can happen to any other patient as well?
Excellent.
Please, over to you, Madam President.
Malnutrition happens to your cancer patients. It's one example. Cancer patients, patients with chronic illness like diabetes, so children, neonates. So it happens to almost, or patients who have had like we mentioned, your surgical patients, your cancer patients, your diabetic patients, your patients with hypertension, your elderly patients. Elderly patients, they get to a certain age to, like I think Dr. Monica shared the example of our loved one with us. Elderly patients who will get up to a point they cannot eat enough on their own. So they become malnourished. And the only way you can take care of that is to help them. Some people will say force feed. And when you force feed, you put a tube either through their nose, it ends in the stomach. That's what they call the nasal. And that was what Dr. Monica was trying to describe to us. And that's why in my conference that I'm having this year, we're going to be having a pre-conference workshop to show people, to train, educate healthcare professionals on how to place feeding tube. Because I'm telling you, that's something that you find out that there's a need to educate people on that. So pretty much a lot of the patients in the hospital, cancer patients, definitely the medications that they're on for cancer has a lot of side effects. A lot of them will not be able to eat well. After Nigeria, where is the next country for the conference, or are participants coming from other? I still have a lot of work to do in Nigeria. I want to go through some major areas in Nigeria, but the next country that I'm going to look at after Nigeria is Ghana. But I think I still have another. So right now, what I'm doing in other countries is sensitizing them, doing some education or nutrition support. But I want to get Nigeria to where I want it to be. And if I can just have like 5 centers, nutrition of excellence in Nigeria, then I can start moving, going to other countries.
Just give us a summary of the message you are trying to pass across.
Okay. All right. The first one is the urgency of addressing malnutrition in the hospital. That is the main thing, the main message I'm trying to send. I'm trying to introduce hospital malnutrition and share with the group the urgency of addressing hospital malnutrition. And I'm also trying to send a message to the powers to be, to the president. And I outlined some key organizations that I feel need to hear this. I started with the president. Then I said the Federal Ministry of Health and state ministries of health, hospitals and healthcare institutions, the NAFDAC, the National Primary Healthcare Development Agency, then pharmaceutical companies and nutrition companies, then non-governmental organizations and public-private partnerships. And I outlined, I may have said it briefly, what I think each of this, and I'll be glad to send the document I have that summarizes everything I'm talking about. For those of you, I'll be glad to send it to CEO Africa and he can share with you guys, if that will help. Then I also seized the opportunity to introduce the upcoming conference that is going to take place in Abuja. And I think the chairperson of the CPC group, she spoke about that. But the message that I personally am trying to send is the hospital malnutrition, and what I feel, what my take on that is the fact that it's time that attention needs to be paid to it to prevent all the complications that are happening.
I want to use this opportunity to call on the pharmaceutical companies, partners, so that they could come and partner with us, collaborate with us, so that the conference will be successful, and then we'll be able to, the message will be passed at the end of the day. Thank you very much.
There was somebody that said, is there a way you can influence integration of clinical nutrition into studies at higher institutions so that students can be properly educated and put into,
Yes, Mr. Remi Oladoye from National Insight. Please go ahead and answer the question, ma'am.
Yeah, I think one way to really influence that again is through education, making sure that all the different disciplines who are members of WASPEN, that they understand about clinical nutrition and then take it back to their respective organization. I also mentioned that I'm a faculty member in 2 pharmacy schools, and I lecture nutrition support there. So that's one way, at least I'm doing it through pharmacy. I'm aware that, and that's why if you all notice some of our keynote speakers, some of them have educational background, and I'm hoping that through our conference, when they speak, they will mention some of the gaps of nutrition in in medical schools, in pharmacy schools, and that it's time for us to make the change. So I'm also a fellow of the West African Postgraduate College of Pharmacy, so I'm a preceptor there. I direct a residency program in one of the teaching hospitals in Del Sud. So nutrition support is one of the learning experiences that I do. So as you continue to teach, hopefully these people that I've taught, they can start, also moving it around to the other places. So that's probably one way that I continue to influence and try to see how we can get clinical nutrition exposed in the different setting. But it's going to be a little bit more work because you all can pretty much tell that the lack of awareness is a huge problem. And we all need to continue to be ambassadors to make sure that we're spreading the word. First of all, we have to believe that it exists. And one way we can believe that it exists is to have data. And I discussed that today. So at least one institution is partnering with WASPEN to do that. We have to have data that says, yes, there is prevalence of hospital malnutrition, and we're trying to do that. So, and then some of us who are experts in this, if we continue to, teach and spread the word, hopefully, I think that we'll be able to address some of all these issues. Like, for example, I'm hoping that National Hospital, after the conference, they will do the same thing that LUT did, have their own nutrition committee, have nutrition support team, and that's how it goes on. Really cultivating and developing centers of nutrition excellence. That's what WASPEN is trying to do.
So, Madam President, my question is this. Are you also proposing that the federal government, through the legislatures, that's the Senate and the House of Rep, should make a policy law that a nutrition committee should be in all our hospitals in the fight against malnutrition in Nigeria? Over to you.
Yes, that's exactly what I'm saying. I'm saying that, number one, institutions need to mandate nutrition screening of all patients that get admitted to the hospital. They also need to mandate multidisciplinary nutrition committee. So those key things, that's what I'm saying. They need to mandate that patients who get admitted to the hospital, as part of their workup by the nurses, by the doctors, they need to screen them for their nutritional status. And there are different tools that can be utilized. And that once they screen the patients and they find out that the patient is malnourished, that will help them to start early nutrition intervention. And the institutions need to have multidisciplinary nutrition committee led by a physician, that we have dietitians, nurses, pharmacists, case managers as members of that committee. So that committee is the one that will govern everything that pertains to nutrition support in that institution.
I really want to thank you, Ma, for this topic. People won't really understand except they have experience of what you're talking about.
Yeah.
Why I'm personally interested in this is because I had a child, and for 2 years, 3 years, she was not eating. We were always in the hospital on admission. But thank God that it wasn't in Nigeria. Her life was saved because we were not in Nigeria at that time. The hospital where we were, Edinburgh Hospital, Johannesburg, it was the nutrition committee that saved my daughter's life.
You see? Yeah.
Yes. Because the nutrition committee kept, coming to attend to her, trying to find out her needs and trying to find out how they could save her life. At a point, we thought we were going to lose her. Because after 6 months of her life, she stopped. She couldn't eat anything apart from fluid. Nothing was passing through her mouth. But at the end of the day, she's 10 years old today. And she was saved because of this nutrition committee that we are talking about today. So this is very, very important and highly recommended for our Nigerian hospitals. I
Yes.
am a witness of how this committee can go a long way to saving lives. Please, ma, do not stop pushing.
No,
Please.
thank you
Thank you
so
very
much.
much.
Thank you so much for sharing that. And you're right. People, because when I first started this morning, they were like, "What's she talking about?" They didn't, one has to experience it, and that's why I will keep on. But thank you. I think that really makes me feel good, to know that there's somebody out there, that And I will tell you another story. There's right here in US when I first started practicing. First of all, I'm a board certified nutrition support pharmacist. There's a lady. That lady had surgery, had complications of surgery, ended up with a short gut syndrome, just like that other boy that I was talking to you guys about. Do you all know that I kept this lady? This lady was alive for at least another 15 years by being fed via the IV way, because anything she ate, she did not absorb it. So if she did not have this specialized nutrition support that I'm talking about, the parenteral, that woman, there was no way that woman would be alive. So everything she normally would have been eating orally was given to her intravenously. So, as she was a nurse, during the day, she would go to work. She had her IV line. She would put on her clothes. Nobody will know she had it. At night, while she's sleeping, she will get the bag of the IV food, hook it up to her pump. So while she's sleeping, she'll be getting her nutrition. That's how that woman stayed alive for that long. So I'm saying this to let you all know that there are going to be instances whereby something happens to somebody. Either, like I just mentioned, they had surgery, they ended up with complications, or there's a cancer patient, is on chemotherapy agents, they have nausea and vomiting, they can't keep anything down. There are a whole lot of clinical problems, issues that, elderly patients that get up to a point that they cannot eat enough on their own. You have to feed them. Force feed them, So WASPEN will not, I will continue what I'm doing. That's why we continue to have these conferences. Like I mentioned, we're trying to get grants and all kinds of things, because right now the grant is for the community malnutrition, not for hospital malnutrition, because nobody really understands it in Nigeria.
My team, the LOC, and then the CMD, his representative, Dr. Badejo, I would want to, on his behalf, say a little about the privilege and honor given the hospital to partner with these great non-governmental organizations. As we are all aware, National Hospital is one of its kind, an apex hospital at that, situated right in the capital of the nation. So partnering with WASPEN, it's not by coincidence. It is, like I said, it is a honor, really, done the hospital to partner with this great organization. So it will be our pleasure to do that, particularly being a health condition, malnutrition every day. It's a good opportunity we're given to be able to tell the whole world, particularly Nigerians, how serious the matter is. Like we all know or have been said today, what malnutrition is in the hospital. It is actually affecting a number of our patients regardless of their status. Once a patient is admitted and is diagnosed to have this condition, there's need for treatment. We may wonder where we see this kind of patients. They cut across the various departments of the healthcare. Is it pediatrics? Yes. In the neonatal ward, it is also there. In the ICU, it's there. Patients living with cancer, that's oncology department, we find them there. Special treatment clinic, patient living with HIV/AIDS, we find this condition there. Psychiatric patients too also have this challenge. Surgical trauma cases, they are everywhere. So the topic for the conference is indeed timely, bridging the gap, integrating hospital and community malnutrition care in developing countries. We all know our country is a developing country, so we need it. And the awareness being created today is because we have seen how severe the problem is. Like our president mentioned, she said we do not have statistics in Nigeria, but we have statistics all over the world. It is noted that about 20 to 50% of our patients in the hospital come down with this condition, malnutrition. So there is need. And in Nigeria alone, UNICEF has told us that among us children, we have 10 million children living, 2 million, sorry. UNICEF said 2 million children in Nigeria suffer from severe acute malnutrition, and only 2 out of these 10 currently get reached with treatment. So the problem is enormous, and there is need for this awareness. So the risk also is another reason why this conference is going to be in the hospital. We see the risk associated with malnutrition more. Increased risk of infection is there. Healthcare costs also get to increase. We also have slow economic growth in the country, which in time perpetuates the cycle of poverty, illness that we see in Nigeria, making us appreciate how serious this problem is. And it is time to talk about it in Nigeria. So we look forward to June when the conference is going to be live in National Hospital, and we're using this opportunity to invite all the multidisciplinary sector involved in the care of patients who live with this condition, malnutrition.
My last remark will want to be to Madam President. I just want to say that from this press briefing, I've learned a lot about clinical nutrition matters. And I was wondering if your next conference would be in partnership with UCH. I think hospital like UCH should also at least benefit from something like this. And you know, Ibadan is the gateway to the rest of Southwest. I know true. You have been to Lut, but consider UCH. Okay. Thank you, ma'am.
Thank you so much. That's a very good point. You're right. You know, I've made a note of that, and I think I know the head of HOD over there. Yeah, you're right. So UCH. Somebody also mentioned the teaching hospital in Calabar to me.
Anyway, my question to the management and the LOC of National Hospital Abuja is how prepared are you for this great conference, knowing fully well that delegates will be coming within Nigeria and outside Nigeria, especially in respect to security? We want you to assure the world in this regard. Thank you.
Yes, we want to assure you that we have been having similar conferences in the hospital, and the hospital is 25 years old, and from inception there has been conferences, and there have not been any form of security issues. So we are further assuring you that hands are on deck, and then contacts have been made to ensure the security is secured that period, God willing. So that's not a challenge. And regarding our preparations, we have gotten our staff, since the conference is actually multidisciplinary. We have gotten staff from various departments to be part of the LOC. And these are top ranking staff, heads of various departments, consultants, in various departments who are part of the LOC, and some of them have even logged in to listen to this press conference. So we look forward to having a safe, hitch-free conference come June.
And I have to say that, thank you, Dr. Adeshola. I really have to say that one of the things that I have noticed working with the organization is the way the institutions have really opened their arms and worked with WASPEN. National Hospital, the LOC group, they've been doing a phenomenal job. They put in a lot of time and effort into meetings, making sure they're paying attention to details. Communication has been great. And so I want to again seize the opportunity to thank our LOC chair for her support. And also, I don't know if she's still on. Did she, Blessing?
Yeah, I'm on.
Okay,
CPC?
Yeah, CPC. Is she still on or did she leave? Okay. I also want to thank her. So it's really been, fun for me working with all the two groups. So again, thank you guys for a job well done and for supporting WASPEN to make this a reality.